Peel and Toronto, for example, know exactly what needs to be done. They haven't got the people, they haven't got the money to do it. And it's heartbreaking.
Canada's COVID numbers continue to climb, but outbreaks are centralized to specific regions and municipalities. Despite that, one infection control expert says local health officers don't have the funding or authority to tailor their responses to the situation on the ground.
Toronto has felt that legislatively it's on thin ice to do some kinds of restrictions that it wants to do. It's afraid of a legal action. The province could pass legislation to indemnify them, to make that okay. And they really need to do that. We really need to allow for local differences in the way the pandemic is managed.
Ontario registered 939 new COVID cases Friday, but more than half are concentrated in 3 major municipalities. Ontario is rolling those regions back to stage 2 of lockdown, a targeted approach that leaves areas with few or no cases unaffected. While this is welcome, infections expert Colin Furness says this authority could be handed to local health officers. But the Deputy Prime Minister says it's not jurisdictional issues hampering public officials, but concern for small businesses already hurt by the pandemic.
Many of them feel themselves to be in a really agonizing position of, frankly, knowing what is the right thing to do, but being reluctant to hurt businesses that are already very hard pressed.
Canada is riding an unprecedented rise in COVID cases, already eclipsing what happened in the spring. Health Canada has released updated models which shows the nation is on track for a worst-case scenario. But epidemiologists say with Thanksgiving weekend, things could still get worse.
My fear is the second wave hasn't started yet. The second wave may start a week or so after this coming weekend, where I'm afraid there's going to be a lot of contact that shouldn't be, and I'm very concerned about what's going to happen.
Furness says while the numbers seem daunting, Canadians can still control their own environments and their own actions. He recommends people keep their bubbles as small as possible, observe public health rules, and listen to your local public health officer to get a better understanding of what the COVID situation is where you live. In Ottawa, Xiaoli Li, City News.